what we often see is that folks are very intimidated to start exercising, especially to start strength training.
Yeah.
They're worried about surgery or an injury, or they just think they can't do it. And what often happens, literally, I would say 90% of the time, is their perception of themselves doesn't match reality. That folks are often way more capable of doing more than what they perceive.
Hey everyone, welcome back to the Reshape Your Health podcast. I'm your host, Dr. Morgan Nolte, and today we have Dr. Dustin Jones, and he's a geriatric specialized physical therapist, just like I am. So welcome. I'm excited to have another one of my kind on here. He's the co-founder of StrongerLife, which is a science-based training center that improves the physical, mental, and social health for people 55 plus. And he is specializing in helping, people age better and helping them really discover their strength, no matter how old they are. And he also travels across the country teaching other rehab clinicians and fitness professionals how to better serve people over 55 plus. And this is really important. So I've talked about on the podcast before, there's a lot of underdosing in geriatric rehab. We're going to talk about that and other kind of major problems going on right now with geriatric rehab and fitness training. But before we get there, just welcome. And will you kind of tell our audience a little bit more about yourself and how you got into this realm of geriatric fitness?
Yeah, thanks for having me on. I'm super pumped to chat with you. So my background in training, I would say originally I was more focused on athletics and sports, which in our background of physical therapy, that's a pretty common track. People probably played high school sports, they got hurt. Oh, physical therapy seems cool because they helped me. I'm going to go to PT school. And I was definitely that type of student. And so I went through all of my training focused on being a physical therapist that mainly works with athletes, maybe a particular high school athletic team, college team, whatever. I kind of went that route. But then when I got out into the field, I took a job in a skilled nursing facility or a nursing home, as some may call that. And what I found really interesting, there were two things that were really interesting. One was really terrible and sad. The other one was really motivating. The first one being, which you mentioned before, the underdosage of how a lot of the folks in that particular setting were given physical therapy, quote unquote, that was way too easy for them. It did not challenge them whatsoever, did not promote adaptation. They were just kicking a balloon. They were flailing their limbs, doing ankle pumps, whatever, saying it's physical therapy, but not really challenging them to a manner that's going to encourage progress. That was really discouraging. And then the second thing was when I would work with the folks on my caseload, I would basically treat them like I would the athletes that I worked with previously or prior. And I would modify some things and scale some things and change things that I needed. But what was really fascinating is that with a lot of those folks, they would improve and show progress more significantly and quicker than many of the athletes that I worked with. And that was very motivating for me. It was very addicting in a way to see someone that may start off in PT that couldn't even get out of a chair on their own, within a matter of weeks, build up the strength to be able to come up out of a chair, maybe using their hands or maybe without using their hands, which didn't always happen. But I did see that trend that a lot of these folks were very sensitive to properly dosed exercise. And after that, I was like, man, this group of people, I want to spend more time with them because they're amazing. They're hilarious, very helpful. And they respond to the skills that I have. So that's when I just said, I'm all in and pursued that geriatric specialization like you have, spent some time in home health, and now using those skills in the context of fitness at StrongerLife.
Yeah, tell us a little bit more about StrongerLife because it's a pretty unique setting. So give our audience just a little bit of background as to what do you guys offer at StrongerLife and how is it different maybe than regular physical therapy?
Yeah, so StrongerLife is a physical location in Lexington, Kentucky, where we have group-based fitness classes. We also offer individual training, and we also offer individual training virtually online, so with folks across the country. it's different from physical therapy in the sense that if anyone's been to physical therapy, you probably experienced this. And I know you have, Morgan, being a PT, is that, we work with people for a period of time, and usually insurance is a factor where we may not be able to see someone any longer, even though we know they can still benefit from what we can provide. And a lot of times towards the end of physical therapy, it's a lot of focusing on building strength and endurance and balance. And we often can't see people long enough to really see as much progress as what is possible. And so they get discharged from physical therapy, and there's just not a lot of places to go. There are, based on where you live, there's some good options, like some silver sneaker classes and classes at the YMCA. And there's probably a gym or two that will offer some type of service that's going to be appropriate for you or that particular person, but they're not all too common. And so we found a huge gap here in Lexington, Kentucky. When we were discharging our folks from physical therapy, we knew they needed to get strong. We knew they needed to be around other people because a lot of them were isolated. They wanted to meet friends. They wanted to have fun and continue to get strong and improve their physical capacity over the long haul, but they didn't have anywhere to do it. So that's why we created StrongerLife. So what it looks like is it's myself and then another physical therapist, Jeff Musgrave, started this to where we have folks from all walks of life, all levels of ability, folks that can't get to the ground, for example, folks that could do burpees for days, folks that may need something to hold on to stay steady, to folks that are running a half marathon. And we have them in a group setting, and we're able to modify all the activities that we do together to where we're all getting a really, really awesome workout and having fun doing it.
That's great. I think that's so good. I think another big missing need, and if I had a second brain, I would start this business, but I feel like I think that maintenance therapy is really important, like that ongoing, like monthly, bi-monthly assessment from a physical therapist, but then getting like a quote unquote non-skilled individual in there for a home exercise program that doesn't cost someone an arm and a leg. I just feel like there's a huge gap. Maybe some students could fill that role, but anywho, that's a discussion for another time. I think the gap that you're filling is so important. And I know that you have a CrossFit background, so I wanted to dig into that a little bit. Do you have your level 1 certification?
Yeah,
Okay.
level 1.
So tell us about that, because I live in a rural area. I've never done CrossFit because of the drive-in and the times. And it's just like, I don't have time for that. I'm not going to make time for that right now. So how did your CrossFit experience and training kind of bleed into this StrongerLife gym?
Yeah, that's a great question, because I've been doing CrossFit for, I think, 3 or 4 years. So a decent amount of time, but not a huge amount of time. Most of my experience has been in kind of a running background, endurance-based type stuff. And that transition from being focused on endurance, which if you are an endurance athlete or runner or jogger or walker, we spend a lot of energy and time thinking about how many miles we may go or how many minutes or hours or whatever it may be. And we may strength train a little bit, but it's not a huge focus, right? It's about volume and miles and time and all that stuff. And when I started to do CrossFit, the shift was very interesting for me, because there's much more emphasis on being a generalist, if you will, that you want to be able to go do that 5K, that half marathon, whatever. You want to have endurance, but you also want to be able to lift a lot of weight and be super strong. You also want to be able to do gymnastic movements that require you to move your body weight on a bar or a ring, for example, or Olympic lifts with a barbell. It asks you to be good at a whole bunch of different things. And it was incredibly humbling, because I was, and still am, not good at a lot of those things. But the more I went and the more consistent I became, the more I was impacted by the emphasis on the strength piece. From the physical side of things, in terms of I've gotten a lot stronger than when I started, obviously, but it influences your perception of yourself and what you're capable of, to where I feel stronger mentally in terms of what my back can handle, what my knees can handle, what my shoulders can handle. I'm much more confident in what my body can do and have a better idea of what it can't do. And that has influenced how I work with many folks and at StrongerLife a ton, because what we often see is that folks are very intimidated to start exercising, especially to start strength training.
Yeah.
They're worried about surgery or an injury, or they just think they can't do it. And what often happens, literally, I would say 90% of the time, is their perception of themselves doesn't match reality. That folks are often way more capable of doing more than what they perceive. And blending some of that CrossFit style training, which we have done at StrongerLife to some extent, really helps people match their perception to reality, if that makes sense. And what we often see is people surprise themselves. They don't realize that they can lift that barbell or that much weight until we give them the opportunity to do that in a safe environment. So the physical side is amazing, but for me, the mental side has been a game changer personally, but then also using that StrongerLife as well.
I think that's amazing. And I didn't really come into strength training on my own until probably I started researching this stuff. So my son will be 4 in June. And so I never really struggled with my weight or my body until after I had him. And then I thought, oh man, like maybe I'm not as top notch as I thought I was physically, And so I was like, let's do some research here and figure out how to get this weight off. And I realized I was doing everything wrong, low fat, low calorie, a lot of carbs, under eating protein, under eating fat, focusing on cardio. And that was really interesting because, necessity requires action. And I had this little boy who always wanted me, and I had 20 minutes at the gym. Ooh. And I also had a weak pelvic floor, right? And it was 20 minutes before the daycare provider at the gym was like, we can't handle him anymore, Morgan, you gotta come take him. And so I was really forced into appreciating strength training and the efficiency that you can do a quick, effective workout in a minimal amount of time. And that really worked for my lifestyle as a new mom with a weak pelvic floor with 20 minutes at the gym before my son needed me. But now I love it. It's like, I just go and I do cardio more for my mental health and to keep up my cardiovascular fitness so I can do fun things. But yeah, like strength training 2 to 3 times a week for me is my new rhythm, like whether it's a high intensity interval training or strength training at the gym. I love it. And so it's fun to kind of hear you say that. And one of my coworkers, after I had Dawson, I don't know, maybe 6 months later, she saw me. She's like, wow, you look great. What are you doing? And I'm like, what we tell our patients to do.
Yeah.
Strength training. I'm just doing it. And isn't it true? Yeah. Like we know so many clinicians, and it's like, are we leading by example? And I think that's a really important conversation to have.
Yeah. And that's a great question. And that's something that I've been chewing on for a while, especially as an educator of teaching continuing education. And, every other weekend or so traveling to some type of clinic or some hospital system or whatever it may be, and getting to interact with a ton of clinicians in our profession of physical therapy and occupational therapy. And the vast majority of folks, they're not even practicing what they're preaching to their patients. And if they are practicing, what I often find is that their perception of strength training really isn't strength training. It's very, very underdosed. And if you spend any time in the literature of strength training, regardless, but then especially for older adults, you'll see a lot of numbers thrown out, right? Percentages, like, when we were studying for our GCS, 60% of a 1 rep max is the minimum to build strength. Like you see all these numbers based on this 1 RM, 1 rep max effort. Right. How much weight can you lift with a particular movement? And the vast majority of clinicians have never even tested that. They've never even done it. They don't know what it's like to give that all out effort. And therefore, are they meeting a 60% of a 1 RM? And the vast majority of folks are not. And that's what we'll see, especially at our courses, because we have people lift a lot of weights.
Yes, I've seen that.
Yeah. That they end up setting personal records at our continuing education course because they've never pushed themselves that much. And sometimes it takes that community piece or a good coach or whatever to kind of push you over the edge. But that's been a very interesting and somewhat concerning trend that I've observed, because, as a clinician, if I'm not practicing this and I don't know what it feels like to give a max effort or even 60% of my max effort, that makes it incredibly challenging to prescribe that to a patient.
Right.
Very difficult to do. So there's just underdosage all around. When we say underdosage, for those that aren't familiar, underdosage being that when we are trying to prescribe this exercise, that it's probably too easy. It's underneath that threshold that is required for you to actually get better or change. And we're seeing way too much of that in our profession for sure.
Let's talk about that in detail. So I want people to compare this to a medication. So let's say you need 20 milligrams of a medication to get the effect of that medication that you need. Underdosing would be like taking 2 milligrams, So, and I used to teach jazzercise before I had kids and started my business.
Wow.
And I saw that a lot. And so it's like, doing bicep curls to music with 5-pound weights, when you can do 30 of them, it's not effective strength training. So we need to back up, and let's really say someone's coming to this podcast interview from scratch and they're like, okay, tell me how I can build the ideal strength training program for me. Let's say they don't really have a lot of joint pain or issues. They're just kind of the average Joe. They want to start strength training and they want to understand it, and they don't want it to take forever. But what is ideal? So let's kind of just break down the basics here.
Yeah. And can be very intimidating for a lot of folks, right? Like starting strength training, you see a lot of complicated rep schemes and numbers and all that type of stuff. The big thing you want to focus on is that it is challenging. It is very, very difficult to do. Now, to determine that, this is what we will do at StrongerLife when people are starting, because initially your perception of challenging and hard, that may just be your perception, and that's not necessarily the reality. And so what we'll do is something called an AMRAP set. An AMRAP set. So as many reps as possible is what AMRAP stands for. And so what we'll do is, let's say we're going to do 5 sets of 5 reps of an exercise. That's a pretty good standard. If you're trying to build strength, that's a good set and rep scheme to do. So 5 sets of 5 reps of a particular activity. And if you're starting off, let's say we're doing something like a deadlift where you're just picking the weight, a dead weight off the ground. It could be a kettlebell, a barbell, a dumbbell, a small child, a bag of dog food, whatever it is. Let's say that first set of 5, feeling pretty good, not too hard, right? Second set of 5, after a couple minutes rest, let's add a little bit of weight. Cool, manageable. Third set, still felt good. Okay, add a little bit of weight, maybe a small jump. Fourth set, so you've done 20 reps at this point, and it's probably a little bit challenging, right? It's somewhat hard. The 5th set, we're going to do an AMRAP set, and this is where you're going to see what you're really capable of. So on that 5th set, you do as many reps as you can. And for new folks, what you'll often see is that they will end up doing 20 reps.
Yeah.
Something along those lines.
Yeah.
That tells you I can lift a whole lot more weight.
Yeah.
I am underdosing. This weight is too easy. When you do that AMRAP set, that weight should be so heavy, you can only do maybe 7 or 8 reps total. That's the intensity that we're looking for. For our experienced lifters, when we get to that 5th set and the AMRAP set, they're typically only able to do 7 or 8 reps. They've dialed in that intensity. Now, keep in mind, that's going to look different for everybody, right? Like I could be doing that and it could be 200 pounds, and I could have Susan beside me and it may be, 300 pounds, right? My high intensity would be low intensity for her.
Yeah.
So it's all relative, but that AMRAP set is really helpful. So 5 sets of 5 is what I would do. On that last set, do an AMRAP set. If you blow off the doors and do like 20 reps, that weight is way too light. You should only be able to do about 7 or 8 reps.
On the 5th.
On the 5th one. And then next time you go to do that, okay, that's where you're going to start probably is with that last weight.
So I have a couple questions there. So do you progressively increase the weight for each set before you get to that AMRAP set?
With newer folks, typically I will.
Okay.
Just to graduate that warm up.
Okay.
To where they're feeling more confident and comfortable. With our newer folks, we'll do a warm up to get ready for everything, but that first set is already going to be relatively heavy.
Okay.
So new folks, I would work your way up. If you're a seasoned veteran, if you will, you can start pretty high early on if you've already warmed up prior to that.
Okay. So let's say that I'm going to do a squat. Okay.
Mm-hmm.
So my normal, and this is good feedback for me too. So my normal is 8 to 12 repetitions, and I do 2 to 3 sets. And so are you encouraging me to increase the number of sets, or how do people structure that? Or does it depend on, the movement that we're doing?
Yeah. So if we're wanting to build strength, we want to have a relatively high intensity. And what that often requires is lower volume.
Yep.
So if you do 3 sets of 8, 3 sets of 12, that could be 24 reps all the way up to 36, 3 sets of 12. So that's a decent amount of volume. If we break that up and do more sets, so like 5 sets of 5, that's 25 total reps, but I'll be able to lift more weight because I'm only doing 5 reps at a time. So it'll be a higher weight, a higher intensity, and that's going to drive more strength adaptation.
Okay.
So for most folks, because most folks will be doing 3 sets of 10,
Right.
3 sets of 8, 3 sets of 12. For a lot of folks, say, hold on a second, maybe do 5 sets or so, but lower your reps, and that's going to allow you to lift heavier weight. That's going to get you stronger.
Okay. So let me ask you this. What if I start and I have plates on each side plus 25, plus maybe 35. And I can do 5 on the first set. And then my second set, I can only do 3. Then do I decrease the weight so that I can finish the last 3 sets?
At 5, you could a little bit. It's not that big of a deal to just keep trying to go for 3.
Okay.
Going to fatigue. I mean, if you're an elite level lifter, then yeah, you're going to start geeking out about some of those things. But for newer folks, don't worry about it. I mean, the fact that you're giving that high effort and you're reaching that threshold is a really good thing. So I wouldn't even worry. I wouldn't even sweat that. Okay.
So let's talk about, you said, what did you say? Between 7 to 8 repetitions to fatigue is the goal. Is that what you said?
That's a good general rule of thumb, because then you're going to be hitting a high percentage of your max capacity. So if we're doing 5 sets of 5, only able to do 2 or 3 more reps beyond that, 7 or 8 reps, that's a pretty good spot to be in.
I think that's something that we really need to touch on. We're not just saying do 5 just for the heck of it. It's like you're doing 5 to fatigue. And so let's really dial in, like, what is that to fatigue, to muscle failure? What does that mean?
Yes. So if we go to this AMRAP set example, we did 1 set, 2 set, 3 set, 4 set, our 5th set's at AMRAP set. That weight should be so heavy you can only do 7 or 8 reps. What that feels like is you can't do anymore. You may even try and you can't even complete it, and you're like, okay, I'm done.
Yep.
So that's what that feels like. You go to failure, if you will, on that last set. And so when you go to lift again, like that first set, I can go heavier. Probably you may start at that weight that you previously did that AMRAP set. You'll do 5 reps. You could do a couple more, but you're not. You're just going to stay right there because you're working at a high intensity of your max capacity. And that's really that sweet spot where we can see, the improvement in strength.
And I think we need to talk about like from an injury standpoint. So do you usually recommend people start at a lower intensity and like build up to that high intensity? Or do you just say, we're going to go for the high intensity right away? Or is it kind of person specific?
I'd say a general rule of thumb is that I'm not pushing them too soon, too quickly. And it is person specific for sure. But like at StrongerLife, the first couple of weeks, we're just having people moving. Yeah. If you come, that's a win, right? Especially if they're completely new to exercise and they haven't experienced like muscle soreness before and things like that. let's just move, let's have some fun, give some high fives, meet some folks, get used to the equipment and some of the lingo that you may not be familiar with. That period also, they're adjusting, they're seeing like what they're capable of doing. They're probably surprising themselves. They're learning a lot about technique.
Right. That's important.
Right. And at that point, usually for a lot of folks, it's a couple weeks, we'll start to progressively load it up. But all that to say, folks are always in the driver's seat. We'll just say, hey, if you want to go heavier, you can if you want to, right? I never manually, make them go heavier per se, but I'll give them the green light for sure. The technique portion, people can get their form down relatively quickly. Some folks, it may take a little bit longer. And so if they aren't showing that great technique, we're still going to have them do the exercise and maybe add a little bit of weight, but they're probably not going to failure per se. Want to make sure their mechanics are as good as they can be when we're really starting to load it up to those super high percentages of their max capacity.
And we should talk about that because I've had another physical therapist on here. She was a PhD osteoporosis research. Mm-hmm. And so she was really obviously recommending some of the same things that you are. And she's recommending more machines for older adults to reduce the risk of injury. So it kind of takes away some of the movement, like extraneous movement that can cause injury. Mm-hmm. And I feel that, I feel more confident doing a rep to fatigue, for example, like if I really want to isolate my quads on a quad extension or on a leg press machine versus if I have a bar and I'm doing a squat. So do you see that? Do you find people are more comfortable maybe going to that failure or fatigue with a machine versus a free weight? Or is it more of just, you got to get used to that concept?
Yeah. I mean, people definitely feel more comfortable with the machines, right? Because they're putting bumper rails, right? Or
that's a good way to put it. Yeah.
On the movement. And so you can really push yourself there, and that's perfectly fine. I would say it may take people a little bit longer to really push themselves if it's a free weight based movement, because you don't have those guardrails like with the barbell and dumbbell and kettlebell and whatever weight you want to use. However, I would encourage folks to push yourself to try some max efforts with some of those free weights, especially as you get more experience, because what you're going to see is the translation to real life activities is profound, to where especially a lot of the movements that we'll use in StrongerLife, or we may call them functional movements, which that's kind of a broad umbrella term, but it's a lot of movements that we need to be able to do for a lot of things to be a human in this world, like being able to pick things up off the ground, to get up and down from a chair, to put something over our head, to get something heavy from the ground up to our shoulders, for example, stairs, steppings, those types of things, to where if we're able to train them in that manner, in a free weight manner, to where we don't have those guardrails, it'll translate a lot more to real life and see some of those real life benefits. Not to say the station-based or machine-based exercises don't translate to real life, because they do for sure, but maybe not as much as some of these free weight type activities.
And you mentioned some. I kind of wanted to pick your brain a little bit more about what are your favorite free weight based functional movements that you find are really effective, especially for, let's say, people over 55 who might be fearful of injuring a joint because they're doing a movement wrong. What are some of your go-tos for people?
Yeah, I'd say if I were to pick a favorite, the deadlift is hands down the fan favorite at StrongerLife for sure.
That kind of surprises me, honestly.
Right. It's the scariest when they come in, but man, after they've been there for a few weeks, it is hands down their favorite exercise. So for those that are listening, a deadlift is where you have a dead weight on the ground. So let's say if it's a barbell or a kettlebell, whatever it is, you're standing over top of that weight. You're bending over, not at your back, but at your hips. So your back stays straight. It's a lot of motion from your hips and a little bit from your knees. And then you mainly use your legs to pick that weight up, but you don't pick it up with your arms. Your arms are straight the whole time. You're doing a lot with your legs.
And your core too, to
Yeah,
protect your back. Yeah.
it's definitely a total body exercise, but we have a lot of folks that are scared to death to lift heavy things up off the ground, to bend over. They've had back pain or whatever it may be.
Yeah.
And whenever we teach them how to do this movement and use more of their hips rather than their back, it changes their whole perception of themselves, because that movement is also the movement that most folks are strongest in. If you do any of the main lifts, like a deadlift, a squat, a bench press, a shoulder press, some of these different movements, you'll have more weight on the bar typically with the deadlift than any of those other movements. And that really changes people's perception of what they're capable of doing. When you've got someone, I think of Beverly Coleman. Beverly wouldn't mind me shouting her name out. You know,
hey,
she was, hey, Beth. You know, she has a big dog that she has to get bags of dog food for. She would get the little 10-pound bags because she was scared to death to touch the 25-pounder. And now she's deadlifting 65, 75 pounds easy, you know, at the age of 75, with osteoporosis and a whole host of other medical conditions that she never thought that she'd ever be able to lift that much weight. Now she's handling that with ease. And now she's actually saving money because she's going to buy that 25-pound bag of dog food. So it changes things physically, but also mentally as well. So that's number one. I'll pick two more. The second one, the squat, like you mentioned. So basically getting to a chair, up from the chair, that same motion, but maybe we can pull that chair out and just see how far you can go down. That is a great total body, but definitely lower body strengthening activity that translates to so many things. You know, walking, stairs, getting to and from a chair, getting to and from the ground. It can be really helpful. Yep. So that one's huge. There's all kinds of ways you can load it up too. You could put something on your back. You can hold it underneath your chin, like right in front of your chest. You could wear a vest. There's all kinds of options. So we find that one to be, we can get all kinds of different types of folks lifting relatively quickly with that one. And then the third one would be something like a push-up. The upper extremity, especially pushing strength, is so important with so many things that we do, especially the ability to get to and from the ground easily. Got to be strong in your arms. So doing something as simple as a push-up, which for many, it's probably on a countertop or a step or a box or whatever chair, maybe on the ground. That is very potent as well. So I'd say those, for us and a lot of the folks that we work with at StrongerLife, that's our top three.
And one other random question, I've heard at CrossFit, when you go, they like take you through the movements and kind of be sure that you're like checked off to know how to do all the movements. Do you do that with your people? Like, okay, let's really work on your squat form or your deadlift form. Do you kind of take them through that as well?
Yeah. So every class we have our class plan, right? Like, what are we going to do that day, or the workout of the day, if you will. And so based on what we're going to do that day, we have a prep or warm up period where we just get our heart pumping, loosen up the joints, but we also do a lot of work on making sure that people are doing the things that we want them to do in terms of technique. And this is when we also are able to find what option of that exercise is good for them.
Yep.
And that's where, with StrongerLife, that's where it can be very different than a lot of other fitness group-based classes, because the class may not be set up to handle a big difference in people's abilities. That's why, especially a lot of these bigger fitness chains, franchises that you'll see, it's a certain type of person that's going into that gym that's able to do all the same things for the most part, right? But our crowd, we got all kinds of different folks in there. Some can't even get to the ground, some can. We have to be able to find options for all those folks, and we'll use that prep period to make sure we're good to go. And so by the time we get through with that, they know what they need to do, how they need to be able to do it. And then we'll get into the workout piece that we'll do together. And that's where the community side comes in, and the hooting and hollering and all the fun stuff.
We did some hooting and hollering and jazzercise, that's for sure.
Oh, I can only imagine.
I loved it. Okay. So what are the top risk factors for getting hurt? When someone's kind of starting, maybe they're thinking, okay, Morgan, I'll start strength training. You've beat this horse long enough. I'll finally go do it. What should they keep in mind to prevent injury starting out?
Yeah. Two things come to mind. The first thing is to think about the danger of not starting.
Nice.
Of how dangerous it could be if you don't start. And, we see this, right, Morgan, all the time in terms of our work in physical therapy. So many of the things that we see when folks come, whether we're an outpatient clinic or home health or a skilled nursing facility, so many of the issues that they struggle with are preventable. Mm-hmm. If they were stronger, fit, better endurance, better balance, it probably would have prevented a whole lot of things. Not everything, obviously, but a whole lot of things. So we have a lot of folks that they're just scared to start. And I really wish that they were more scared to keep doing what they're doing. Mm-hmm. The maybe sedentary behavior or not really challenging yourself or pushing yourself, that opens the door to physical decline, and you can do something about it. So that's the first thing. I would not be scared to start. I'd be scared to not start. The second thing is so many injuries are related to you trying to ask your body to do something that it's not ready to handle. Yeah. Which sounds silly, right? Yeah. And the easiest way to prevent that is that progression, slow progression and listening to your body. So it's a partial responsibility of you, right? But also your coach as well, to be able to, or your PT, to observe, to give you options that are appropriate to your abilities and to progress those, but not make these huge jumps. It's a gradual progression in weight or even volume or time, just gradually progressing your program that's going to give your body the ability to adapt. And when I say adapt, that means your muscles are getting stronger, your tendons are getting stronger, your bones are getting denser. Your body will adapt to where it can handle more and more, and you won't get hurt. So that initial progression is pretty important.
Yeah, it's go ahead.
And I would say it's what I've found too is that is much harder for the folks that were previously active. Mm-hmm. Or competitive, like yes. The second time arounders, right? Like the former runner, played basketball or whatever. They, had some kids, had a busy job. They said, all right, enough of this exercise crap. I'm just surviving right now. And then life slows down and they come back, but they still have that athlete brain. They still remember how fast they ran or how much weight they lifted. And they try and start back where they used to be, but their body is very different. Yes. And the weekend warrior, if you will, that's another name for it. But those folks, I'm much more cautious of them. I love it when folks have said, I've never done this before. I've never exercised. Like, great. We're working with a clean slate. I'm more scared of the person that comes in telling me their PR of their mile that they did 20 years ago. I'm like, okay, we gotta make sure dial this back. Yeah.
Pump the brake. I think another thing too is consistency. Like my dad and my mom, I've been harping on them for years to exercise. They're finally in a routine. But with my dad, especially, he would start and he would stop and he would start and he would stop. And he would always be like, I don't want to be sore. Every time I go, I'm sore. I'm like, that's because you go once a month, Dad. Yeah. You got to up the frequency a little bit. So, how would you recommend someone schedule their strength training sessions? Like twice a week, 3 times a week? If they want to go every day, working kind of different muscles, what are your general recommendations for the frequency and that we work our muscles?
Yeah. So the frequency at a minimum, a couple times a week. Yeah, for sure. That can be tough though, if you are just solely relying on that, because like you said, that delayed onset muscle soreness or DOMS can just kind of linger on, and it's kind of counterintuitive, but the best thing to counteract that DOMS is actually to keep moving. Yeah. just got to get into it, start moving, and that will wear away. And so what we do a lot of strength training at StrongerLife, to where most of our folks, they are lifting relatively heavy 3 to 4 times a week, but they're different muscle groups.
Right.
So we're not doing squats 4 times a week per se. If we do squat, let's say we lift heavy, let's say we do that 5 sets of 5 of a squat on Monday. Well, we're probably not going to go that heavy or do 5 sets of 5 of a squat again that week, but we may do like air squats, for example, the same type of movement, but not having weight. So that can be helpful. So trying to counterbalance it with what body parts or movements that you're challenging is huge, and then continuing to move despite having that muscle soreness. So what you'll see, like for how we program, we'll have like a heavy day on Monday where we're doing our back squats, 5 sets of 5. The next day may be a little more cardio based, where we're just moving, not lifting heavy weight per se, and that can help counteract a lot of that muscle soreness. And then by Wednesday, we're ready to lift again. We may not lift squats. We may do overhead press, for example. So it's constantly, varying that to where you're not just beating down one part of your body over and over and over again, multiple times a week.
I think one takeaway from today for me is less is more. And I think that this is a delicate balance. And so I'm going to explain what I mean. I'm used to doing, 2 to 3 leg exercises at the gym. I might do like a hip thrust bridge, a split squat, and squats, and then maybe a deadlift too, or a straight leg deadlift. And so from this conversation, what I'm going to try is even lowering my reps further. So reps or repetitions for people who have been listening thus far and they're like, what the heck is a rep? If I'm doing 5 repetitions and then 5 sets of that same squat exercise at a higher load, I think that's great, but I'm going to have to time manage myself, and I won't be able to probably do 3 to 4 leg exercises, maybe 1 to 2. And my little achiever mind always likes to think more is better, more exercise. If you can get 3 to 4, why don't you do that instead of like 5 sets of the same exercise? So that's kind of a big takeaway for me. And then I want you to talk about that DOMS a little bit more, because that's my mom, and hypertrophy, because my mom's 2 beefs for strength training, which she does. She does the circuit at her gym that she likes. And you kind of get to the point with your own parents where you're like, just good job, just keep it up. But you coach all these other people and you're like, I'm just done coaching my own parents.
My mom's a member at StrongerLife. I know exactly what you're saying.
And they're just wonderful people, but I'm just grateful that they're going, and I'm done nitpicking what their choices are.
Yeah.
And so she's like, Morgan, I don't want to get bulky. And I'm like, Mom, you don't have the testosterone and you don't eat the volume to get bulky. So can you kind of talk about women maybe who are listening and they're like, I don't want to lift weights because I don't want to look like Ryan Reynolds on TV. It's not going to happen.
Yeah. I don't think people realize how hard it is to become like that.
They eat a lot of food. Like they eat a lot of food.
They're gym rats. They eat a lot of food. Like it's very, very challenging. And then, like you said, just the sheer hormonal differences alone are going to prevent women from looking like Ryan Reynolds. Or The Rock is another one that I'm like,
The
oh
Rock's
gosh.
Can you just imagine his training schedule? It's like probably a full-time job for him.
Right. So yeah, the whole I don't want to get bulky thing, you're good. Don't worry about that.
Probably just an excuse.
I've never met someone to where that actually happened. In StrongerLife, for example, you have to work extremely hard to even notice somewhat change, in terms of bulking up, in terms of like toning, if you will, or decreasing their body fat percentage to where their muscles are definitely more defined. That is definitely very achievable and a goal for many folks for sure. So the whole bulk thing, I wouldn't worry about that. The muscle soreness side, and that was the other beef, right? That your mother had.
Yeah. She's like, oh, Morgan, I'm just so sore after I lift. And I'm like,
Yeah.
it's a good thing, Mom. That means that
Yeah.
you're getting stronger. And so
Right.
you can tell how I communicate with my parents, right? Don't we all do that a little bit? We all nag on them a little
Oh
bit.
yeah, 100%. So yeah, that's where like at StrongerLife, we're very intentional our first 2 weeks with folks, which we were not when we started. I was trying to get people to that higher percentage
Right.
as quickly as possible. And let's go. Come on, heavier, blah, blah, blah. And these people were wrecked. They just started exercise. Their muscle soreness was just through the roof. They could barely get out of bed the next day. Like I was doing them a disservice. But what you see is that the more consistent you are, like you said, over time, that soreness goes down and down and down. Now, I will say it's not like you're never going to have muscle soreness, because you are. It's just not going to be as debilitating. But the more consistent you are, you're also going to see the progress and the improvements that often happen when you have experienced muscle soreness. And that's when you start to be thankful for it. Like you said, like you almost like are chasing it in a way.
Yeah. It's like
But
if
your
I'm not
tolerance,
sore, it wasn't a good workout.
yeah, it's the tolerance for that goes up tremendously. So I don't want that to come across as like we always want to be walking around complaining and aching. Like that's not the case whatsoever. But man, if you stick it out this first few weeks and stay consistent, your tolerance for that soreness goes up tremendously, and the overall soreness will typically go down. I will say though, and this is where my wife's a physician. She does a lot of precision medicine that involves a lot of genomic analyzation, and what that area in terms of epigenetics and that whole realm, they're actually showing that folks can have a genetic predisposition to having more delayed onset muscle soreness. So there are folks that when they do strength training, they're much more likely to have more severe muscle soreness than others. And what they often do with those types of individuals, they may supplement, like zinc, for example, is a very common supplement. That's everyone's going to think, oh, I must have that gene, therefore I'm going to, which is not necessarily the case. It's not as common as what you want to think. But there is some individual variability in how we experience soreness. So I do want to acknowledge that for sure.
That's good. So keep moving is one thing to deal with the soreness, get the blood flowing, get the muscles loosening up. A couple more questions before we wrap it up. Do you do any mobility work? Because he kind of mentioned this, but when you're doing those functional movements, you are naturally incorporating quote unquote mobility work just to keep those joints flexible and mobile. Do you do any other specific mobility work with your StrongerLife clients?
Yeah, a lot of that will happen at the beginning and the end of our class structures or our individual sessions. So with that warm up, that prep that we do, we're doing a lot of mobility where, let's say if I'm squatting, for example, the squat requires a lot of movement or range of motion from your ankles, your knees, your hips. And so we're making sure that those joints are warmed up, loose, that they're ready to rock. Those are usually a lot of dynamic stretches, if you will. So we're moving. We're not holding a static stretch for 30 seconds or a minute. We're moving, but trying to move through our full range of motion to get all those joints lined up. So it'll be dependent on what we're going to be doing that day. And then when we're done, that's when we'll do a lot more of the static stretching. So if we do, let's say we did a lot of deadlifts that day, the deadlift uses a lot of your backside, your booty, the back of your legs, your hamstrings. So we'll do a lot of static stretches of like a hamstring stretch, for example. So the front is more movement based mobility, if you will. And then the end will be more static stretching. And folks that's when they're relaxed, calm, hold the stretch, talk it up with their neighbor, just kind of let the heart rate come down. And that's what that'll look like.
Awesome. And then another question was, when do you recommend people start strength training? Because when we were prepping for this interview, you said, when is it time to start strength training? Yeah,
the very common question that we will get, and I would say right now, yesterday, 20 years ago, just get going. Just get going. We have, especially at StrongLife, we have a lot of folks that have had an injury, they've had a surgery, or they're going to have a surgery, or they've just gotten a diagnosis of breast cancer and they're going to start radiation in 3 or 4 weeks. The stronger you are, the better off you're going to be, the more resilient you're going to be, whatever life throws at you. So I would start now. And if you find someone, a qualified physical therapist, not every physical therapist, but someone that actually practices what they preach, or a fitness professional that can introduce you to a solid exercise program that is tailored to your body, your ability, you can get a lot of benefits very quickly. It's going to make you better off for the long haul. So I would say right now is the best time.
Yep. And then last question, you mentioned it offline. We were talking about our biggest beefs in geriatric physical therapy. And I've told this quote before, but my favorite quote is from this book. And it says, the only reason that we should be having an older adult kick a ball or kick a ankle weight from a seated position is if their goal is to kick a ball from that seated position. It's a pretty pointless exercise. And you said not only that, but it's dangerous. And so can you explain that just a smidge more to kind of wrap it up, the danger in this underdosing that's just rampant among geriatric physical therapy?
Yeah. I mean, it's along the same lines of someone that's worried about starting, right? You need to be more worried about not starting than starting an exercise program. But for so many clinicians, especially in the context of physical therapy, we'll have people come into our door, or we go into their home or whatever. We're in a very interesting situation. We have so many folks that have deconditioning, pain, some type of functional ailment that's literally threatening their independence, their quality of life.
Yes.
And they're coming to us for help. And what we do is give them a freaking long arc quad or ankle pump, or we throw a balloon in between their knees and tell them to squeeze it. Yeah. Like that is going to combat and defend them from, pain, weakness, deconditioning, threatening their livelihood and independence. We're wasting their time, and we're just putting them in more of a dangerous situation that's opening the door to continual functional decline, potentially a fall, potentially not being able to live in their home or wherever that is for them. It's an urgent situation. And yet we often just waste that opportunity with these underdose, these easy exercises. So for clinicians listening, my gosh, don't waste that opportunity. We need to challenge individuals because we know they can respond relatively quickly. And that could be the difference between someone being able to stay in their home or not, or preventing that fall or not. And we're in a really unique position. We often waste it, but we don't have to. Definitely, we don't have to.
Well, thank you so much. And I would love for you to share, where can people learn more about you, both from the StrongerLife standpoint, and then if clinicians are listening and they're like, oh, I need more of that in my life, let me go learn from him. Where can they learn from you?
Yeah, so a good home base from the StrongerLife side is StrongerLifeHQ.com. So StrongerLifeHQ.com, that's all one word. A bunch of resources, videos. If you have questions about these exercises and intensity and all that stuff, we've got a bunch of videos, free resources on there, and you can shoot us an email. That's all on that site. From the education side of things for the clinicians, if you go to ptonice.com, that's with the Institute of Clinical Excellence. And so we teach within the older adult division, the courses there. So ptonice.com is a good place for the education side.
And we will link all those resources below. Any like social media places that you're most active?
Instagram.
Okay. I'll link up that.
Yeah, whatever. But those two sites are I'd say the main ones.
Perfect. Okay. Thank you so much, Dustin. I've appreciated this conversation. It was a long awaited one about geriatric rehab and the importance of strength training and being consistent and working at a hard enough intensity, and just how important it is to maintain your mobility and your independence and your quality of life. So thank you very much.
Thanks for having me on. This is awesome.
Yeah, we'll touch base again soon. Thank you.
All right. Thank you.